Hello everyone, welcome to Pediatrics and Neonatology. Today in this video, I will discuss Attention-deficit hyperactive disorder or ADHD. Well, ADHD is the most common neurobehavioral disorder of the childhood. Prevalence of ADHD in children is 3 to 7% and it is more common in boys than girls. Now, brains of children and adolescents with ADHD are 3 to 4% smaller than those children without the disorder. The more severe ADHD symptoms, the smaller will be their frontal lobe, temporal gray matter, caudate nucleus, and cerebellum. Now, in order to make its diagnosis, the behavior must begin before age 12 years, must be present for at least 6 months, must be present in 2 or more settings, and reported as such by independent observers and must not be secondary to another disorder. Now, the diagnostic criteria of ADHD. There are 2 major symptoms: inattention and hyperactivity and impulsivity. First, I will discuss inattention. 6 or more of the following 9 symptoms should have persisted for at least 6 months. Number 1. Child often does not give close attention to details or make careless mistakes in the schoolwork. Number 2. Often has difficulty sustaining attention in the task or play activities. For example, has difficulty remaining focused during the lectures, conversation, and lengthy reading. Number 3. Often does not seem to listen when spoken to directly. Number 4. Often does not follow through on instructions and fails to finish the schoolwork. Number 5. Often has difficulty organizing tasks and activities, has poor time management and fails to meet the deadlines. Number 6. Child often avoids, dislike, or is reluctant to engage in the task that requires sustained mental effort, for example, schoolwork. Number 7. Often loses things necessary for the task or activities. For example, pencil, books, wallets, keys, eyeglasses, or mobile. Number 8. Child is often easily distracted by the extraneous stimuli. Number 9. Child is often forgetful in the daily activities. Now, these inattention symptoms are more common in the girls and often cognitive impairment is also present. Now, the second major symptom of the ADHD is hyperactivity and impulsivity. 6 or more of the following symptoms should be present for at least 6 months. Number 1. Child often fidgets with hands or feet or squirms in seat. Number 2. Often leave seat in the situation when remain seated is expected. Number 3. Often runs about or climbs in situation where it is inappropriate. Number 4. Often unable to play or engage in the leisure activities quietly. Number 5. Is often on the go, acting as if driven by a motor. Number 6. Often talk excessively. And number 7. Often blurts out an answer before a question has been completed. Number 8. Often has difficulty waiting for his or her turn, for example, while waiting in a line. And number 9. Often interrupts or intrudes on others, for example, butts into conversation or games, may start using other people's things without asking permission. Now, these hyperactivity and impulsivity symptoms are more common in boys and are associated with aggressive, disruptive behavior. Now, 2 important differentials of ADHD are hyperthyroidism and child abuse or neglect. Now, I will discuss the management of ADHD. First is the behavior management. This includes increasing structure in the environment, positive reinforcement, that is rewarding good behavior, counseling, teaching good thoughts, problem solving, engaging in pleasurable activities, and effective communication. Cognitive therapy, it focuses on teaching relaxation techniques and self-control. Then there is special education. highly structured classroom with low student teacher ratio to emphasize their educational experience. And third is medication. These include stimulants such as methylphenidate, tricyclic antidepressant, imipramine. Now, liver function test, complete blood cell count, and baseline ECG should be done before starting these medications. Now, the prognosis of ADHD. Usually, a childhood diagnosis of ADHD often leads to persistent ADHD throughout the lifespan. Now, 60 to 80% of the children with ADHD continue to experience symptoms in adolescence, and up to 60% of the adolescents exhibit ADHD symptoms into adulthood. Now, in children, a reduction in the hyperactivity behavior often occurs with age, and other symptoms can become prominent with age, such as inattention, impulsivity, and disorganization. Consistent treatment with medication and behavior and cognitive therapies can lower the risk of adverse outcome. Okay, thank you. Please subscribe to my channel.